Thank you. And I appreciate what you have raised, Senator Kane, about the hepatitis B and the response that we have seen. Alaska has quite an interesting history and story. Among our Alaska Native population, we were seeing some of the highest rates of hepatitis B some decades ago. And we were really targeted as a pilot project to see if we couldn't reduce these rates with an emphasis on the vaccine, because what was happening was young people coming down with these cancers, particularly kidney, liver, the organ diseases, and we have virtually wiped that out. And we see such extraordinary success. I agree with you. We don't want to return to that period in time. So I appreciate what was shared just now. I want to direct my questions to you, Dr. McGee, initially here. I come from a state where it's big, wide open spaces. We are geographically disadvantaged in so many ways. But it's not just Alaska, it's other remote and rural areas where people face longer travel times. There are fewer transplant centers. We don't have a center in the whole state of Alaska. We have more limited access to specialty care. But I hear from people in Alaska that the wait for an organ transplant is not only long, sometimes it's almost impossible, which is very discouraging. So I'd like to hear how you feel the OPTN is working to ensure that allocation policies appropriately account for some of these geographic barriers, so that we don't have a situation where you literally have to be in the big city around medical hospitals in order to be a recipient of an organ donation, that we're not leaving our rural and our remote folks behind.
Thank you, Senator Murkowski. There's almost no state that does not have an area that is under-resourced, no matter what state you're talking about. So in Alaska, I appreciate it's more difficult. Within the bounds of the OPTN, we cannot establish a hospital in Alaska. That would have to happen by lots of things. But we're looking at access to care. Traditionally, the OPTN had only really had from the time the patient came in and was listed. So we're actually looking at referral data, like when do people get referred, and even earlier than that, to look to see what are the barriers there. Anytime we do anything, we also look at impact on rural centers as well. So those are the two main things that can be done within the confines of the OPTN.
So let me ask how you are doing when it comes to overall communication with patients, because again, this is one of the concerns that we hear, that patient-centered reforms based on the input from patients themselves has perhaps in the past not been the best. And I know we've got some new policies, some new programs that OPTN has put in place to improve the communications with patients, with the candidates, with the donor families, the whole network there, including the waitlist status changes, the organ offer notifications, donor family outreach. How can you share with me how you are making this information more readily, easily, accessibly available to the patients?
Certainly. As you know, communication is always a challenge, even within the OPTN. And there are multiple sources of information, but within the OPTN, recently, the central access point, if you will, to the physician and the information has been centralized to one website, and there's a patient-centered design going on in that. And so the goal would really be to not create 3 or 4 websites that or sources of information that all reflect the efforts of the entire network. So there are contractor websites, there's the OPTN website, and so we're working on standardizing that. We also look at patient focus. All of us that are physicians know how the importance of being able to communicate with a patient at their level and give them as much information as they need. So the information is being centralized and made sure to be compliant with patient level.
So do you feel that the current board then is doing a good job in ensuring that patient and donor voices are heard? I mean, you've shared how you're communicating outward, but are you also confident that you have the capacity to be receiving that information from the patients themselves?
That's a great question because, and no, I'm not entirely confident we have that under control, just as the board and the OPTN committees are only representatives of part of the community. My goal has been to really increase that community input. So I think there's the opportunity to partner within the OPTN, there are patient advisory committees, which is one form, but that isn't always representative of the whole country. So my goal would be to come up with approaches to hearing from experts, whether they be in transplantation or the patient experience. So organizations like the National Kidney Foundation, other things that are larger patient focusing, including even just the general population, because donors are another group of people that we do not,
Right.
what is the American citizen want?
Mm-hmm.